The ranking member of the full committee, Mr. Waxman, for 5 minutes.
Thank you very much, Mr. Chairman. The Republicans on this committee and our health subcommittee have held 5 hearings since December on the Affordable Care Act. And each of these 5 hearings repeats the themes that they expressed when they opposed the bill. And they certainly never expected this to become law. Republican members can't accept that health reform is working, and it is now the law of the land. They opposed it from the beginning, and until the day the President signed the bill into law, they insisted it had no chance of passing. Until the Supreme Court ruled it constitutional, Republicans said, oh, it's not constitutional. Until the day President Obama was reelected, they insisted the American people would vote him out of office so they could overturn this law. None of that happened. And now they call this an oversight hearing because they predict all these terrible things to happen. They're not predicting, they're wishing bad things to happen. This is not a hearing to be constructive. It's a hearing to attack the law and hope that it doesn't work. Well, the Affordable Care Act will go fully into effect, and Americans will never again have to worry about their ability to get affordable, high-quality health insurance. So the Republicans are saying, well, the implementation is not going to go smoothly. Well, implementation of any new big program has its kinks, but the Affordable Care Act is proceeding on schedule, and it's done a remarkable amount of good for people. Over 3 million young adults now have health insurance. Over 100 million Americans have received pre-preventive health benefits. More than 6 million seniors have saved $6.1 billion in the Medicare Part D drug program. And beginning next year, tens of millions of Americans who would otherwise be without health coverage will have dependable, quality health insurance. My Republican colleagues said people want certainty. Well, the certainty they would have if there was no Affordable Care Act is that millions of people would be discriminated against because they have pre-existing health conditions, because they offer a risk to the insurance companies to have to pay more money for their care. They'd have the certainty of knowing that insurance companies would do everything they could to keep them from getting coverage if it's going to cost the insurance companies money. And that's what we wanted to change. Republicans still oppose the Affordable Care Act. They are not taking a constructive approach. They're not saying, what can we do to make this law and its implementation work more smoothly? They're saying, what can we blame people who supported this law about problems that may come up? Well, I'm pleased that we have at this hearing today, again, Gary Cohen, who was here in December answering many of the same questions. I'm sure he'll be addressed today. The Center for Consumer Information and Insurance Oversight has made huge progress in implementing the Affordable Care Act. Success doesn't change the opinions of my colleagues on the Republican side of the aisle. It makes them even more determined to look for something they can criticize. And today on the House floor, we're going to vote on a bill that they've produced because under the Affordable Care Act, we had a high-risk pool for people with pre-existing conditions who are waiting until January to be able to buy health insurance without being discriminated against, without being charged more money because of those pre-existing conditions. We have spent $5 billion on a program to precede that, to help people with pre-existing conditions to be in a high-risk pool. And we ran out of money. Republicans don't mind that we run out of money for everything in this that the government does, because they supported the idea of sequestration happening. And we're running out of money in all sorts of places where the government has an obligation. But we've run out of money for that pre-existing pool, pre-existing medical problems pool, until the last few months of this year. So the Republicans, suddenly concerned about people with pre-existing conditions, decided to make sure that fund has enough money to go on for the rest of this year. But they funded by taking away the public health prevention funds until 2016. Makes no sense whatsoever. We're happy to support the continuation of that pre-existing pool till the end of this year, but certainly we could have found a better funding source, and the Republicans have denied the opportunity for any other source to be offered on the House floor today. You have to question how sincere they are about wanting to help people with pre-existing conditions, how sincere they are wanting to see a smooth implementation of the bill now that it is law. They want this bill to fail. They want to go back to the time when millions of people had no chance for insurance. That's the certainty they want to offer, and it's the certainty that led us to have the Affordable Care Act passed into law. I congratulate Mr. Cohn and his agency for doing all that they're doing. It's an important service to make sure the law succeeds, and that's what we should all want to see happen now that it is the law, and they lost the last election and their last chance to repeal it.